My name is Michaela, and I'm a patient stakeholder for a PCORI-funded study. I work in San Francisco as well. I'm a patient care technician in the emergency department there, and I actually started getting involved with this study early on in the early phases before it was funded by PCORI as part of a patient focus group with the Women's Community Clinic. And we would have bi-monthly meetings. That was used as time for us to talk about this iPad app that was developed by Dr. Christine Dellendorf. It's a birth control app that helps women navigate through birth control options, and it asks them questions about their personal preferences and their lifestyle to help navigate through different methods and narrow down a few suggested methods that later on will be used during an appointment with a provider. So this particular app really allows women to get that information on their own in the beginning of before they have an appointment with a provider, and that way it really allows for patients and providers to have a more meaningful, meatier conversation about their needs and their wants, and it equips them with information so that they can have these really intense conversations, and they're not just asking like, what is a NuvaRing or what is the IUD? They already know what that is, and they understand how that works with them and their preferences, and then they can engage with the providers in a more effective way, I think. I would love to integrate this app into different settings. So in the emergency department would be a great setting, because I know while a lot of women aren't necessarily thinking about birth control when they come into the emergency department, it's something that does get discussed in different cases, and the doctors don't always have time to talk about the different methods in the emergency department. So this would be a good opportunity to use an app to talk about those methods, or even in a different healthcare situation, not necessarily navigating birth control methods, but navigating different medications for high blood pressure, or what this means, and using an iPad app or some kind of technology to help educate people while they're in a healthcare setting, so that they have time and opportunity to talk to doctors in more depth